Good morning. Welcome back to our regular BOCC meeting. We're coming out of recess, actually, as the Board of Health to conduct our quarterly Board of Health meeting and update. So, Dwayne, the floor is yours.
I'll make a motion. We open the Board of Health meeting.
Okay, we can do that too. Second.
Second.
Okay, we have a motion and a second to open as the Board of Health. All in favor, please say aye.
Aye.
Aye. Motion carries. Now the floor is yours.
Thank you, Commissioners. Good morning, everyone. Good morning, citizens listening in and staff here today and guests. Dwayne Smith, Public Health Director for the county, here to give our quarterly update. We've got a lot of information to share and some exciting updates to convey. Quick look at the agenda and our regular look at what we're trying to accomplish in rebuilding the health department and the requisite infrastructure to serve the needs of citizens. I'll start with an update on the Women, Infants, and Children's Women, Infants, and Children program, the WIC program. You may recall that prior to COVID, Tri-County Health Department sent out to Elizabeth, to the Old Frontier High School, a couple WIC educators once a month to serve folks eligible for WIC and nutrition services and whatnot. That went virtual during COVID. We want to resume that. The program does require a registered dietitian to do the nutritional assessment. That's not a capability we have currently. We are contracting at no cost with the new Douglas County Health Department as they also stand up their WIC program beginning in January. They will send out WIC educator or educators, depending on the volume of folks we see, to the health department in Kiowa. We anticipate using existing space in the Health and Human Services building for those meetings with WIC clients. That will begin sometime in January. Don't know if it'll be the first week or later on mid-month or whatever. We'll begin messaging that availability to the community and through human service organizations that may already serve clients that will be eligible for WIC, and work over time to connect people to other resources, whether it's SNAP, the Supplemental Nutrition Assistance Program, commonly known as food stamps, or temporary assistance to needy families, some of those entitlement benefits that folks can avail themselves through human services. And of course, we'll be communicating the availability of food resources through the food banks and all the other necessary complementary resources in the community.
You have a quick question on the no-cost contract. I wish we had a lot of those, but I assume that they get reimbursed through the work is it funded through the work they do regardless?
Yeah, good question.
Regardless of where the population is?
So how that works is the State Health Department, CDPHE, likes to see counties working together. I don't want to call it a reimbursement. The funding that Douglas County Health Department will receive from CDPHE and some of the support when they write their scope of work, they are including Elbert County as if we were somewhat of a two-county health district. They're just, adding us to their scope of work, and then they receive the reimbursement or the grant funding. So, yep.
When you say a no-cost contract, that's always sounds good.
Well, thank you for asking for clarification for that. Yeah. Similarly, with the tobacco prevention and cessation support, whereas Tri-County previously through tobacco tax funds that are eligible to health districts, they provided that support to Elbert County. Beginning in January, we'll have that work supported, by Douglas County Health Department. Overall, Elbert County residents have very low rates of tobacco use. It's very uncommon from my experience to see someone smoking. It's more smokeless tobacco. So really that work is kind of maintenance of low levels of tobacco use within the population, as opposed to a lot more folks in some counties that may need help with quitting and the quit line that the state runs and things like that, and other supports. So basically consistent with Elbert County's very high level of overall health. Staffing updates. So I probably at some point mentioned, hopefully, that we had hired 2 part-time nurse practitioners. So Dr. Lori Coring, who's a nurse practitioner, she is in on Mondays. She is a certified pediatric nurse practitioner. That's what the CPNP is. So her specialty is going to lie within the birth to 21-year-old population. And then Brandy Konechny is our other nurse practitioner. She will be in on Tuesdays. She is a certified geriatric nurse practitioner. So her specialty area will lie with seniors. Yesterday, for the first time, I guess just through kind of happenstance, Brandy, who was in yesterday, took care of our first ill client. It was someone that works at one of the school districts, was not feeling well, thought they had strep or, didn't know, just felt crummy. And did they call? And we said, come over? Yeah. This is the first time the health department has seen a sick patient, a sick client, in years, 5, 6 years or more. Health departments typically don't see sick folks, but now that we have the capability of the nurse practitioners, we did, nursing staff ran some tests. Because the tests necessitated some cartridges that go in the diagnostic analyzer, and the cartridges are expensive. We, prior to administering the test, said, here's our cost. Are you interested in paying for this cost, or we can refer you to another provider? And the client said, go ahead and run all the tests. So we just charged what our cost was. I think it was like $130 for the cartridges that run the tests and things like that. So that was a big deal, I think, to us. To me, at least, it was, I'm sure it was. And Brandy remarked that it was good to, see someone in that space. So we will begin messaging the availability of not only well visits and sports physicals and, kind of those prevention type things, but also for the minor acute illnesses that are within the scope of work. And then, real quick, and I won't belabor these points, just the focus of the nurse practitioners and what they can do. I think to date, we've probably done at least half a dozen, maybe about 8 sports physicals. For high school athletes, that's a physical that I think at a Minute Clinic or a general practitioner, probably they charge $30 for that, and I think we're asking $20, but if that $20 is a hardship, we're obviously not going to let that stand in the way of providing the sports physical. So we're, beginning to do those little things that will progress to addressing the access to care issue that was identified in the community health assessment. This is our standard slide, what we're aiming for. Focusing on or transitioning to communicable disease, Colorado is experiencing an increase of cases of respiratory syncytial virus. Again, this affects the very young and the very old. Most kids will get an RSV infection before age 2. It's historically or typically, mild. However, what strain is circulating currently appears to be especially virulent. I know children's hospitals across the country, their ICUs are full of RSV patients. Yesterday, we were notified of 2 cases at Singing Hills, 1 case at Kiowa Elementary. It's in the community, so please we encourage everyone to please take all necessary precautions, which are the typical hand washing, just not shaking hands, keeping your hands out of your eyes and face and things like that, cleaning surfaces regularly. We currently have low rates and volumes of COVID infections. It has taken a slight uptick over the last couple weeks. The volumes are not really of concern at this point, depending on who you talk to and what models you look at. The consensus is that at some point we will have a wave this fall or early winter. My guess it would be, shortly after Thanksgiving holidays and between Thanksgiving and New Year's. Our percent positivities over the last week and a half have been a little bit concerning, greater than 10%, meaning the virus is circulating pretty well in the community. So again, standard precautions. No known cases of monkeypox, nothing to worry about there. Just a quick update on year-to-date in COVID. Whereas last year, for the entire 12 months, we were about 1 out of 8.8 known confirmed infections of residents in the county. This year, we're about half that. We have had several, I would say, in the last couple weeks, hospitalizations. Most of them are older folks, although I believe there is one 30-something-year-old. Don't have any information about any comorbidities, though. As you can see, our trend line appears to be just normal ebbs and flows since the end of the Omicron wave in March last winter. Our environmental health updates, we're on par with previous years, so no real revelations here. Our revenues overall for environmental health might be maybe 5% lower than last year, but generally on par. And continuing to issue plenty of septic permits. We should probably exceed last year's, or at least come close to it, by the end of the calendar year. And there's our inspections for the quarter and our revenue. The food licenses, this really hasn't changed since the last update. All the licenses, that's kind of a seasonal issuance. So everybody gets their food license taken care of in the first several months. So they're good for the year. So that, not a whole lot of movement there. Vital records. So we're doing a really good job of issuing birth certificates and death certificates. Note that the number of certificates issued does not correlate to one certificate per person. A client came in a couple weeks ago and got 10 certificates. So, but the takeaway is that we're issuing them locally. Folks no longer have to go to somewhere outside the county to Castle Rock or to Aurora to get it. So just the convenience factor is the point there. And with more records issued, we're generating a little bit more income. This income is covering, more than covering the time spent, the fractional time spent by staff to issue the records, look up the records, verify, issue, print it, all that, the security paper and whatnot. Our team was recognized by the State Office of Vital Statistics on 100% on the quarterly application audit. This is just a process or checks and balances to make sure that all of the numbered security papers are accounted for, that all of the T's are crossed and the I's are dotted on the record, that there's no mistakes. Yeah, biosolids, I don't have an explanation, but it's been really busy the last several weeks. So these townships noted here, the R57 West and the T6 South, the northeast part of the county, northeast of I-70 are the majority of these applications, and then less on further west on County Line Road. It is wastewater, treated wastewater from the metro area that is filtered, I want to say 8 times, and from the waste treatment facilities, tanked up, shipped out here, spread as fertilizer. The nitrogen content has some value for the property owners that have contractually agreed to allow that.
Yeah, if you could. What was your question? Thank you, John. And since John didn't have a mic, it was just an encouragement to tour the Metro Wastewater plant and see what they're actually doing out there. So thanks.
So just by way of heads up on this contract, the current contract does expire on December 31st. We'll need to have a conversation about that probably some point before the 31st of December this year. I have no concerns over continuing it. Ideally, if we can figure out a way to do the necessary inspections or related scope of work to where we can capture or avail ourselves some of the funding tied to that, that would be nice.
There were some reimbursements if we did engage in that.
So in terms of health promotion, we had another successful blood drive on the 27th of September. Not quite as many units and donors as the first one, but we anticipate this will be a quarterly occurrence. The next one will be on January 11th, same location at the exhibit building. The 365 Health Fair on October 8th, we had 54 participants come and get lab work and other avail themselves of other resources and services. We had a great volunteer turnout, 40 volunteers. We have a debriefing with 365 Health this afternoon in a conference call. This was really kind of a trial run, for lack of a better term. This is something that was requested by citizens in our community health assessment. I think we learned a great deal about what worked well, what we could do better, timing, preparation, all that. So we anticipate this will be an annual fall event and we've already discussed ways that we can expand services to include things like more cancer screenings, and hopefully, with advance notice, can get on the calendar to have the mammography tractor trailer come out and perform mammograms for interested participants. We have provided epinephrine pens, the EpiPens, to school districts. That is for emergency treatment of life-threatening allergic reactions, either caused by an allergy or exercise-induced episode, or sometimes it's an unknown trigger. We've provided Narcan to interested school districts for, again, not so much for preparing for an overdose among a student, but probably, if it were to happen, more likely a school visitor, whether it's at an event at the school or an athletic contest or something like that. And staff just recently distributed the AntFlow menstrual product dispensers and period products to the school districts in last week, I think y'all did that, right? Okay, a couple more deliveries to go.
I was just going to say, for the blood drive, at our next director and electeds meeting, I don't think we'd have any problem with just letting employees know that if they want to donate blood, that's that's a valid place of duty. They don't need to use sick or vacation time.
Okay,
If that stopped folks. But we got a lot more than 20 people kind of on campus. We might as well make sure everyone knows.
And I thought I had included a slide on this, but I didn't, so I'll need to just verbalize. The big lift that we're working on over the next couple months is the CureMD electronic health record. And when I say this is a big lift, it's all of us are probably involved in probably close to 20 hours of training and onboarding through CureMD. This includes getting registered with Medicaid and Medicare so we can submit healthcare claims and get reimbursed for that. And also for third-party insurance carriers, United Health, Blue Cross Blue Shield, and so on and so forth. We'll probably have, I think, 6 of the most common carriers whose insurance we will accept. Never had to navigate this before, but it's a lot of legal stuff, a lot of paperwork that we're currently in the process of providing to CureMD. We'll get training on everything from how to, when you first walk in the clinic and fill out the necessary paperwork and getting that electronically recorded. This will, once we get through this, obviously we'll be able to bill public and private insurance for it, for all those things I talked about earlier, sick visits or well visits or, vaccinations, and so on and so forth. But it will set the foundation for us to be able to eventually, and maybe a year or 2 down the road, apply to become a rural health clinic. Again, noting that access to care is an issue, particularly for seniors and for lower income earners, but also I think the initial conversation surrounded convenient access to care and not having to go to somewhere outside the county to get care when you feel sick and spend half your day. So more to come on that. I know I'm very excited. I think our staff is very excited about all this. And I do want to recognize the team, several folks. So the 365 Health Fair that was a lot of work. So I want to especially recognize Lisa, Helseth, and Sarah, and Marissa. for all their efforts. And that's everything from like planning it to like physically setting up all the tables and getting tablecloths and setting up the tents and, you know, getting the venue prepared in the exhibit building. And loads of, you know, communications back and forth. Also want to recognize Stacy Reinhardt for her consistent good work on all things environmental health. Our contractor, Catherine Reiber, who is just a steady presence for our COVID surveillance. Certainly our new nurse practitioners who are, by my view, just really excited to be here and excited about learning rural public health and are going to be and are already a great addition to our team. Under the umbrella of It Takes a Village, I want to recognize folks from other departments in the county. Misty Callahan in Health and Human Services. She was instrumental in getting the police chief in the town of Elizabeth and the police department to install condom dispensers in the restrooms at the police department. Trish Cruz, who is always a great help with social media and every other little thing that I ask her for guidance on. Brenda Crow in Human Resources in assisting us with hiring the nurse practitioners. Tiffany Hermes in Finance, who's a one-person show right now, and I know she's overwhelmed, but she always picks up the phone and answers my questions. Mark Dettenreeder, in economic development for his great work with Agate Water and their challenges out there and helping them get some funding to address the situation. And then lastly, Michael Sarabia in the buildings department. Michael just, gosh, he spent hours putting together a desk for our nurse practitioners, and it was, I don't know, 170 different parts or something ridiculous like that. You know, in the winter, he's out there in the cold shoveling our sidewalks. And when we, yes, wonderful demeanor, so kind, so friendly. So, you know, if I've neglected to mention anyone, I just want to share our appreciation for other folks in other county departments because, you know, we can't do what we do without their help, so. Lisa and Sarah, do you want to share anything? Yeah, so far this year, I don't think we've had any positive rabies samples come back. We've had a couple, as Lisa said, a bat and a raccoon. Thank you publicly to Comanche Veterinary Service that assists us with the preparation for the specimen. I won't go into the gory details of how that's prepared, but it has to happen in order to get it to the state lab so that they can test the specimen. So I think that's it. So
one quick one on your list of, oh, we have a question from a member of the public and a member of the staff.
It's about...
Please identify yourself and your address for the record.
My name is Amanda Moore. I actually have a question about, are there, just because with all the information about COVID and vaccines and all of that kind of stuff, what is there a disqualifying thing for blood donation?
I'll let Sarah handle that.
Okay.
So,
Thank you.
no, as far as COVID, flu, vaccinated, unvaccinated, there is no disqualifications as far as the blood donation. However, the one thing we're seeing that people are getting turned away from is travel to Ireland. So there has been an outbreak of mad cow disease in Ireland, and so the one qualification they're saying is there's no way to test the blood for it. So unfortunately, there's no time limitation if you've spent a prolonged amount of time in that country. That's the one thing they'll turn you down from. Okay? Yep.
All righty, thank you. And I did have just one on your, the insurers that you were looking at. Is military TRICARE one of those by any chance? Because we
You know
have
what?
a
Good call, good catch.
pretty
I
big
don't think-
population of younger vets that aren't Medicare eligible at this point.
Yeah, we'd forgotten about that. Thank you for bringing that up. We had not submitted the list. And I think we get, with our contract with QRMD, I think we get 6 third-party providers. And I think if we wanted to add another, it's only like $50. So, but yeah, we'll make sure we get TRICARE in there.
Appreciate that, thank you.
Just one other addendum to Amanda's question. I can't imagine this happening in Elbert County, but there's an Ebola outbreak in some countries in Africa. So I think recent travel to those countries where Ebola is present would probably disqualify you from donating blood. You know, the state is continuing to monitor the Ebola situation, and that's just it's a hemorrhagic fever, horrible thing to experience, from what I've read and learned, but I don't think we have too many travelers there, so.
I appreciate your time, and thank you very much, and everything that you and your team and the greater village, I guess, are doing, so thank you. That, I don't think we have any other business, so
Motion we
we
close
move.
the Board of Public Health.
Second.
Okay, motion and a second to close as Board of Health. All in favor, please say aye.
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 Aye. And that's all the business we have, so I'd accept a motion to adjourn for the day.
I'll make a motion, we adjourn.
Second.
All right, motion and a second to adjourn. All in favor, please say aye.
Aye.
Aye. Motion carries. We are adjourned.